Hello everyone, my name is Erin Lee Cordes, and today I'm going to be telling you a little bit about mine and my collaborators' research about the associations between needs fulfillment from household members and psychological distress during the COVID-19 pandemic for both LGBTQ+ and non-LGBTQ+ individuals. So let's get started. Many of you are likely familiar with self-determination theory and the idea of basic psychological needs. But for those of you who aren't, I'll give you a quick 1-minute overview. So self-determination theory posits that we all have three basic psychological needs. First, competence is all about feeling effective in your environment and like you're capable of doing things that are important to you. Environments are key here. If we're living in an environment that we feel competent in, for example, with people who support us or tell us that we're doing a good job, we're going to be feeling pretty good. Second, autonomy refers to behavior that is self-endorsed. It's about acting in a way that you find to be congruent with yourself and your identity. You're able to make choices and outwardly behave in ways that align with your identity. And finally, relatedness is feeling cared for, connected to, and understood by others in your environment. It has to do with the sense of belonging, of feeling like you matter to people in your life and your environment, and that those same people matter to you as well. We know that when more of these basic psychological needs are met, people tend to concurrently show higher psychological well-being. We're doing better when our environment, including the people in that environment, allow us to meet these needs. Conversely, when these needs aren't getting met or aren't getting met in an optimal way, people tend to show higher psychological distress. For example, people who aren't getting these needs met in their environment tend to show higher rates of depression, anxiety, or stress. In short, the more that these needs are being met in a satisfactory or optimal way, that's good for us psychologically. And conversely, the less that these needs are being met, that's not so good for us. In the past year and a bit, something fairly substantial has shaken up almost everyone's environment: the ongoing COVID-19 pandemic. Right, so we can make some pretty good guesses about how the pandemic might have impacted people's basic psychological needs. First, many people are feeling less competent than they normally would, less able to do their jobs well due to competing priorities or mental health challenges, for example. People are experiencing restricted autonomy in the broadest sense, not being able to go out and do things that they like and that resonate with their identity. For example, if an important part of who you are comes from volunteering outside of your home, you might have been struggling quite a bit here. And of course, many people aren't able to feel as connected to their communities relative to when we were able to gather together and do all of that in-person relating. That being said, it's possible, likely even, that not everyone is struggling to the same extent. For instance, if you've spent the lion's share of the pandemic in an environment and amongst people who support your basic psychological needs, you might not be doing too badly in these domains. You might also be experiencing less psychological distress relative to people who are living in environments that are less needs supportive. One group of people who are more likely to be experiencing environments that are less needs supportive are LGBTQ+ people. Indeed, the pandemic might have made it especially hard for LGBTQ+ people to get these basic psychological needs met. For instance, those who are residing with people who are not fully supportive or even aware of their LGBTQ+ identity may have less ability to fulfill their basic needs in this stay-at-home context. In this case, we would see some pretty big impacts on LGBTQ+ people's competence, especially if they aren't receiving support or positive feedback when they're pursuing work or other things that they're passionate about. Autonomy, in that LGBTQ+ people in unsupportive environments may not be able to behave in ways that are congruent with their full identity. And relatedness, in that LGBTQ+ people might be separated from their community of friends or others who understand and support them, and in that they might be living with people that they explicitly don't feel those important connections with, or that they don't feel they can fully be themselves around. So here are the research questions that we were interested in this current study. First, we wanted to know if SDT needs fulfillment from those that one was living with during the pandemic would predict psychological distress. We were interested in that relationship at a single time point. So if we look at one snapshot of people's experiences, what's that relationship between needs fulfillment and psychological distress looking like? And we were interested in how that association would play out over time. So does needs fulfillment predict the trajectory of psychological distress for people across time? Second, we were interested in examining possible differences in these associations when comparing LGBTQ+ people to non-LGBTQ+ people. Okay, so what did we do? First, it's important that you know the rough timelines around when we collected this data. A lot of stuff has happened in the past year, and this pandemic moved and changed pretty quickly. So here's our timeline. First, you'll remember that the WHO officially declared that the COVID-19 virus could be characterized as a pandemic on March 11, 2020. Our research team started collecting the data set that we're currently working with on April 30th, and we completed that data collection around the end of July. During that May to July period, we had people participate in a 28-day daily diary study tracking their experiences with COVID-19. On day 1, which was whichever day that participants joined the study, participants were asked to complete an intake survey. This survey took about 30 minutes to complete and included questions about participants' age, race, gender, and sexual orientation. People who identified as non-heterosexual, non-cisgender, and/or non-binary were later labeled as LGBTQ+ people in our dataset. We also asked participants about their subjective financial security, so how stable their income was, and about who they were living with during the pandemic. And in this intake survey, we took baseline or intake measures of how well participants' basic psychological needs were being fulfilled by those that they were living with, as well as baseline measures of psychological distress using the DOS. Then, every day for 28 days, participants were asked to complete a shorter diary survey. We sent that link to their email inbox every evening at around 5 p.m. Participants completed a slightly longer survey on a weekly basis. This weekly survey included the same measures that we used at intake to measure psychological needs fulfillment and levels of psychological distress. Our participants were 1,484 people who were predominantly Canadian, with a mean age of about 44 years old. The majority of our participants were white women who had received some university education. And overall, about 33% of our sample was comprised of LGBTQ+ people. So to address our research questions, we used latent growth curve models. Why this approach? Well, it was the best way for us to understand the trajectories of people's change in psychological distress over time. This approach was also the best way to determine if and to what degree our predictors would help us understand inter-individual trajectories of change. Conceptually, what we're doing here is using structural equation modeling to examine a couple of different things. First, we're looking at how having your basic psychological needs met really well or not well by the people that you're living with. We're looking at how that predicts overall psychological distress on average at a single time point and over time. So for the on average single time point part, we'll be looking at intercepts. For the over time part, we'll be looking at slopes. Second, we're comparing LGBTQ+ and non-LGBTQ+ people. We want to see if the same basic model holds for both of these groups. Overall, an examination of our basic fit statistics suggests that our models are fitting the data quite nicely here, so that's a good start. Okay, so let's address our first research question and look at the association between needs fulfillment and psychological distress at a single time point for both LGBTQ+ and non-LGBTQ+ people to address our second research question. Okay, so we're first going to look at the non-LGBTQ+ people. Here, we see that as basic psychological needs are being more fulfilled, psychological distress is lower. So there's a negative relationship between having basic psychological needs fulfilled by those that one is living with and psychological distress for non-LGBTQ+ people. You'll remember that we also included age and financial stability as covariates here. With these covariates, we see that older folks and people who are more financially stable also had lower levels of psychological distress. So they're doing a little bit better than their younger and less financially stable counterparts. For LGBTQ+ people, things actually look pretty similar. So here, as basic psychological needs are more fulfilled, psychological distress is lower, a similar negative relationship between needs fulfillment and psychological distress. And again, among LGBTQ+ people, we see that older folks and people who are more financially stable also had lower levels of psychological distress. So what does this association between needs fulfillment and psychological distress look like over time for LGBTQ+ and non-LGBTQ+ people? Let's start with a visual. First, let me orient you to this graph. So on our x-axis, we have our 5 weekly time points. Our orange line represents LGBTQ+ people, and our blue line represents non-LGBTQ+ people. On our y-axis, we have mean scores on our measure of psychological distress. Here, the scores range from 0 to 3, with 3 indicating higher psychological distress. So we do see that LGBTQ+ have higher psychological distress relative to non-LGBTQ+ people. That orange line is higher up on the chart. But let's keep things in perspective. Overall, everyone, both LGBTQ+ and not, is doing surprisingly well. Psychological distress scores are pretty low overall here. Let's zoom in a little bit more though so that we can see some nuances. Here I've reduced the scale for the y-axis a bit, so our scale is only going up to 1 now, although the scale does go up to 3, right? The pattern here is that LGBTQ plus people are staying at about the same place, close to 0.9 for psychological distress over time. They're not really experiencing a lessening or a worsening of psychological distress as time goes on. Non-LGBTQ plus people are improving slightly more than LGBTQ plus people with time. That blue line is ticking down, indicating lower psychological distress, but not by much. So here are the numbers that we want to look at. First, you'll see that there isn't a significant association between need fulfillment and psychological distress for LGBTQ plus people. But we do see that there is a significant association for non-LGBTQ plus people. If you're savvy, you'll notice that this is a positive standardized beta value, suggesting that something interesting might be going on here, so hold that thought. For LGBTQ plus people, we see that although better needs fulfillment was associated with lower psychological distress at intake, it's not associated with change over time, right? That value is not significant. So LGBTQ plus people are staying at about the same place for psychological distress over time, regardless of whether they're high or low in needs fulfillment. In other words, needs fulfillment isn't playing a role in LGBTQ plus people's experiences of psychological distress over time. For non-LGBTQ plus people, we see that there is an association with better needs fulfillment and psychological distress over time, but it's not the association that we might expect. What these numbers mean is that the more that non-LGBTQ plus people's basic psychological needs are getting fulfilled, the less improvement we're seeing in their psychological well-being over time. So as needs are getting more fulfilled, they're improving less, which is kind of strange. We do have a few ideas for why we might have seen this pretty counterintuitive finding. Primarily, we think that there's possibly a methods effect happening here. First, you can see that our blue line for non-LGBTQ plus people is starting off pretty low in psychological distress. So at intake, they're already pretty low, like 0.6 there. It might be that with our measure, we captured the point that non-LGBTQ plus people just couldn't improve anymore, or at least not at the same rates. It's possible that non-LGBTQ plus people were possibly already doing about as well as they could do once they hit around time 2 of our study. It's also quite possible that our analysis is just missing something. For example, we controlled for age and financial stability, but we didn't control for what day that participants enrolled in our study. It might be that we would see the relationship that we expect, so as needs get met, psychological distress steadily decreases, if we controlled for these more specific aspects of time. Indeed, you probably remember how quickly things were changing in relation to the pandemic in May, June, and July of 2020. That's not something that we're accounting for yet in this model. And finally, in this model, we're using people's psychological need fulfillment scores from intake only to predict trajectories across time. We aren't bringing in or accounting for any concurrent changes in needs fulfillment over time. Only using the intake data when there's theoretically change over time in needs fulfillment as well is of course only going to give us a certain picture of the phenomena here. Okay, so let me summarize for you. We first found evidence that people, both LGBTQ+ and non-LGBTQ+, who weren't having their basic psychological needs met by people that they were living with during the earlier months of the pandemic, were also experiencing higher levels of psychological distress at the beginning of our study. We also found that across all time points, everyone's levels of psychological distress were generally pretty low. That goes for both LGBTQ+ and non-LGBTQ+ people. This might be because we started collecting this data about a month and a half after the pandemic was declared and stay-at-home orders subsequently came down. It's possible that there was an initial spike of psychological distress, but that people habituated fairly quickly. So we might have missed an initial spike of distress and only captured people habituating to the situation. We also saw that LGBTQ+ people were experiencing slightly higher psychological distress relative to non-LGBTQ+ people and didn't seem to experience change in psychological distress over time. Change in psychological distress over time was also not associated with having basic psychological needs met for LGBTQ+ people, which is an interesting finding and worth exploring a bit more. Non-LGBTQ+ people's psychological distress did seem to decrease a little bit over time and was positively associated with having their psychological needs fulfilled. That is, the more that non-LGBTQ+ people's basic psychological needs were getting fulfilled, the less improvement we saw in their psychological well-being over time. This is an admittedly strange finding, and right now we think that it's down to a methods effect. Indeed, there are a lot of different factors that are playing into people's experiences during the pandemic. It's important to be aware of how the methodology that researchers have used to collect their data might be playing a role in what we end up learning about this time. So thank you so much for your time and attention. Please do feel free to contact me by email or on Twitter if you have any questions or comments.